Hello guys, welcome to my YouTube channel, and today we will talk about liver function test, also known as hepatic panel. So first of all, we will see what liver is. It is the largest, most versatile organ in the body. It consists of two main lobes, left lobe and a right lobe. Together weigh from 1400 to 1600 gram in a normal adult. Liver synthesizes major biological compounds including proteins, carbohydrates, and lipids, and many enzymes and all fat-soluble and several water-soluble vitamins produced in liver. Liver function tests, also referred as hepatic panel, are a group of blood tests that measure the level of several substances, such as enzymes and proteins, that are excreted by your liver. Levels that are higher or lower than normal can indicate liver problems. Several biochemical parameters are assessed in LFTs. These are bilirubin, which can be in conjugated and unconjugated form, alanine aminotransferase ALT, aspartate aminotransferase AST, alkaline phosphatase, gamma glutamyl transpeptidase GGTP, total protein, and albumin, etc. Bilirubin is a yellow pigment formed when RBC break down, or it's the breakdown product of hemoglobin. When RBC complete their lifespan, which is about 120 days, they are destroyed in the body and hemoglobin is released. This hemoglobin further break down into heme and globin component. The heme component is converted into biliverdin, which further convert into bilirubin. This bilirubin is in unconjugated form, also known as indirect bilirubin, which is insoluble in water. So, it binds with the albumin and transported to the liver. In the liver, bilirubin is converted into conjugated form, which is water soluble and can be easily excreted out through urine or feces. So, if there is increase in the bilirubin level, it indicates that there is something wrong in your body. The main cause of increased bilirubin level in blood are hemolysis, breakdown of RBCs. Number 2. Failure of conjugating system in liver. Number 3. Obstruction in the biliary system. Alanine aminotransferase ALT, also called SGPT, serum glutamate pyruvate transaminase. ALT is mainly found in liver, low in kidney, heart, and skeletal muscles. Liver injury cause elevated level of ALT in blood. ALT is more liver sensitive and specific indicator of liver diseases as compared to AST. Its level is directly related to extent of liver injury, and raised level of ALT can be seen in chronic alcoholism, hepatic cancer, and chronic cirrhosis. The third parameter we will talk about is AST, aspartate aminotransferase, also called SGOT, serum glutamate oxaloacetate transaminase. AST is high in heart muscles, liver, and skeletal muscles, but low in kidney, pancreas. Damaged tissue release AST in blood. Therefore, AST level in blood is directly related to extent of cellular damage or injury. AST level in plasma is elevated or after cellular injury, and peak level at 24 to 36 hours and return to normal in 3 to 7 days. AST level in blood is always high in patients with chronic hepatocellular disease, acute hepatitis, cirrhosis, and acute extrahepatic obstruction. Factors which interfere with the serum AST level include pregnancy, in which there is decrease in AST level, exercise which increase level of AST, drugs such as antihypertensive and oral contraceptives. Alkaline phosphatase (ALP) is primarily found in liver, bone, and placenta. The test has low specificity for liver disorders because there are other conditions that can also increase alkaline level in blood. These are cholestasis, in which there is obstruction of intra or extrahepatic bile duct, pregnancy, bone diseases especially osteoblastic cancer and Paget's disease, and new bone growth can also cause the elevation in alkaline level. So, because of these uncertainties, another test is performed called GGTP, gamma glutamyl transpeptidase (GGTP). This test is highly accurate in indicating cholestasis. It is the most sensitive liver enzyme for detecting biliary obstruction, such as cholangitis or cholecystitis. GGTP level is very high in liver but low in kidney, heart, intestine, brain, and prostate. Elevation of GGTP parallels that of alkaline in liver diseases, but GGTP is not increased in bone diseases. So ALP is increased but GGTP levels are normal. That indicates bone disease. I hope you have found this video helpful. If you liked the video, hit the like and subscribe button. Thanks for watching.